Hi, I'm Kelty and I'm from One Well Wellness Center, and I'm going to teach you a somatic exercise today that can be used for almost anything in the lower extremity. It's a great exercise that you really need to focus on, so when you're doing it, try not to have any distractions, try not to be talking to somebody, because if you don't do it the way we tell you to do it, you're not going to get the benefit. So the instructions are really simple, but sometimes it's really hard to do. So what you're going to do is you're going to lay down flat. You want to be rested like Jolene's feet are rested here. A lot of times we start kind of in this tight position. Try to relax your lower limbs if that's at all comfortable to do. So the instructions are going to be to start with turning your foot on one side, let's say inwards. But the goal is that you actually start where you're articulating at the ankle. So what people do is when they say, oh, turn the foot in, they move the whole body, lower body as a unit. And that's the thing we're trying to not do. We're trying to make you move in a new, novel way. So I'm going to get Jolene to slowly, like everything we do with somatics, is you're going to turn your foot in first. Once it gets as far as it feels comfortable, the knee is then allowed to turn in, then the hip will turn in a little bit. You might even get a little extension on the back at that same side. Then you're going to turn your foot out, but again, just like Jolene did, you're going to articulate at the ankle, you turn the foot out, the knee then follows out, the hip follows out. You might even get to the point where you arch a little bit on the opposite side. That would naturally occur if it's going to occur. And then you just go slowly back in. You'll not hold it either end. You're just going to move in, you're going to move, and then you turn, always starting here like Jolene does, turning the knee out, turning the hip out. So you're going to want to do that thinking about it, because you're not going to do it naturally at all. 5 or 10 times on one leg, get it really good. And then you'll probably want to do it 5 or 10 times on the other leg. If you get really good, you can start doing it both the same direction. Let's say both go to the, okay, we're going opposite. We're going to go out at the same time, still moving at the ankles, the knees, the hips, and then she's going to turn in at the ankles, which is really tricky, and you're going to slowly go in. Perfect. Always ankle, then knee, then hip. Then you can also do it so they both go to, let's say, the right together. So they're both going right, and then they both move the feet first, and then go to the left. Good. So we roughly say 5 or 10 times on each one of those levels, but your therapist will give you good instructions on what to do, and the whole goal is really just to be aware of the way you're moving and how to control that movement.